Hey ReFam, my name's Kate and welcome back to My Surgeon Says, podcast with real surgeons, real experiences and real advice. Scars are obviously a huge part of our everyday here at Re, and we're always looking for the safest, most effective ways to help our patients get the best scar possible post-op. So we've got a special guest in today, Helen from Nokori. Nokori is an Australian-based company that makes natural, evidence-based scar care. We chat about how their products work, whether a scar can ever be too far gone to fix, and Helen reveals the biggest mistake patients make when it comes to scar management. As always, please rate and review wherever you're listening or watching. It really does help people find our little podcast. Helen, thank you so much for joining us. Peek behind the camera, I forgot to press record, but we're going to recreate the magic again. Sorry. Everyone share this now because it's extra important we're doing it twice. We're joined today by Helen from Nokori. If anybody has come to Replastic Surgery since last year, you would have received Nokori's duo kit of silicone tape and scar balm. They're in beautiful, gorgeous packaging. Everybody has loved them. So we just wanted to talk a bit more about the process, how we got there, and how to use them for any new patients coming in as well. Helen, thank you so much for joining me.
Thank you for having me.
God, sorry. So what was happening in your life, your career that kind of led you into this world?
So it was back in 2019 and I was on a little holiday down south, and unfortunately I had a surfing injury and I sliced the tendon in my foot, which led to me being in hospital on Christmas Day for surgery.
Was this the top of your foot or the bottom of your foot?
It was the top. It was right. Okay. It was the tendon that goes to the big toe and the second toe.
Oh.
Yes. So what it made me realise is a few things. One, that going into surgery makes you feel quite vulnerable. You feel quite out of control. And it was when I got home and I took all the dressings off and I saw the incision for the first time, I found it really confronting, to be honest. And the surgeon had done a fantastic job, but I just hadn't been given any guidance, information or support around how to manage the scar. And obviously we're in Australia, I wear flip-flops and beautiful sandals, and I was looking at this ghastly incision on my foot thinking, what do I do? And so that's where the story began. And my background in the medical world, so I worked for Johnson & Johnson for 20 years, and I worked in the cosmeceutical world, so I was very up on all the pharmacological stuff and the cosmeceutical stuff. And so it opened the door for me to then go and speak to some plastic surgeons and find out, what are you doing for scar care? What's out there and what do you offer your patients? And it came to my attention, bearing in mind this was back in 2019, the scene is very different now, but back then there wasn't a huge amount being offered. And so, yeah, it really made me realise that there was a gap in the market that needed to be filled.
And it's a huge thing for plastic surgeons. They take a lot of pride in their scars in a way that, and fair play to them, other disciplines don't. Maybe they're more focused on saving you from a car accident, whatever. But obviously how people scar is integral to our practice, and people will see an abdominoplasty scar or a breast reduction scar, and in our before and afters, at best case scenario, they're seeing 4 months post-op, where a scar can still be quite, maybe not aggressive anymore, but still quite prominent. Yep. And that can be a real inhibitor for people to take that jump because they're like, oh, well, I don't know, I hate all this loose skin or I hate this, but that scar, being able to use the scar treatments and have an impact on how they heal is obviously super, super important to the patients. What were the biggest challenges you faced going from that idea and then turning into a real product?
Yeah, so of course it takes a lot of money. It takes a lot of research and development, and it takes a lot of time. So I stepped away from the corporate world and I put a lot of my money into starting to build the business.
Yeah.
And after about 2 years, I actually had to go back into the corporate world because I needed to fund it.
Yeah.
So I went back into the corporate world for a couple of years, and then I was able to go fully into the full-time position. So I guess it's just the amount of effort, time, money, the challenges that come up across the journey. It's quite a roller coaster.
How did you work with the co-founder? Like, what were your two kind of different skill sets?
So my co-founder, Joe, is amazing. We've been together now for 7 years, working together for 7 years. So he's a very good friend of mine. And it was in the early stages when I was building the business that he was in between jobs and we kept bumping into each other. It was actually in Bondi. We both lived in Bondi. And he could see one day, he was like, what? He was questioning me. He's like, what are you doing? I was working on spreadsheets and he just could see I was looking a little complexed. And he said, can I have a look? Can I help? And he just got really curious about what I was doing and what I was starting to build. And he actually started helping me. And his skill set is so opposite to mine. Amazing. So it was like the match made in heaven. Yeah. And he came on board for about 2 years. He had a small bit of equity at the beginning. We had a sweat equity agreement. What that means is you give someone time and they have a bit of equity in the business. And he delivers a certain amount of work for me each week. So that's how we started off. And then eventually after 2 years, he came to me and just said, I love what you're building and what I've been part of. Can I come in fully?
Yeah.
And so, yeah.
Amazing. How did you find meeting plastic surgeons? Because it is something that they take very seriously and they're not just going to let anybody in the door and near their patients.
Absolutely. Other surgeons look up to plastic surgeons. They look up to what do they do, because it's all about the aesthetics and that end result. So it's so important they get that right. I was very lucky in the fact that I had some really good relationships with some plastic surgeons and I was able to really understand it from their perspective and what it meant for them. But yeah, it's such an important part for them. I think everyone now, well, most plastic surgeons now like to include something or make sure that part is very carefully looked after. And of course, it's a really nice value add for the patient. It takes the stress and anxiety out of it for the patient. They're often thinking, what do I need to do? What should I use? So it's a really beautiful touch for them. And then it also really helps the surgeon, right? Because they know that their patients are being looked after and using the right products to get the best recovery and the best outcome.
Yeah. If somebody hasn't heard of silicone tape, gel, anything, this is their first time, can you explain what it is and how it works?
Sure. So there's many different types of medical grade silicone. The two predominant players are 100% medical grade silicone tape and 100% medical grade silicone gel. And both products do the same thing. What they're doing is they're providing a protective, semi-occlusive layer over the incision to help moisture stay within the skin. It's called reducing transepidermal water loss. And what that does is create the perfect, almost optimal environment for improving the appearance of your scar. Because if moisture is lost through the skin, then the collagen is going to start to overproduce. And that is when you get abnormal scarring. So they're both doing the same thing, but with the silicone tapes, you've got the added benefit of having the physical pressure pushing down to help soften and flatten the scar as well. And so it's also something that patients love because they, from a psychological perspective, they can see it's covered, it's protected, especially if they're wearing a garment or their underwear is digging in directly on the incision. It's just really nice to have that physical barrier across the scar. Yeah. But one thing to note is that with 100% medical grade silicone products, no ingredients are going into the skin. So even with the gels, the molecules are too big. They're not there to penetrate the skin. They're there to work on top of the skin and create that environment, optimal environment for healing.
And then how does that work with the scar balm?
So the scar balm is an oil-based product. The texture is really nice for scar massage. And there's a lot of research that supports scar massage, helping to improve the appearance of scars, of course, because you're going to massage the scar and get that pliability back into it, get it more flexible and break down that scar tissue. So it's a really important aspect of healing the scar. And so the scar balm has been designed specifically for scar massage, but what it's also got is active ingredients that are going to help from an anti-inflammatory perspective and reduce that redness and that itchiness and the tightness that often comes with the healing scar. So they're really complementary of each other, which is why they come in a kit.
Yeah, right.
So the silicone with the scar balm come in a kit, and great balanced approach to scar care.
And how do those two work together? Because I know you can't use them at the same time.
Yeah, exactly right. So as tempting as it is sometimes, unfortunately, the tape won't stick on top of the balm. And also they're doing two very different things. You're using the scar balm for massage and the ingredient penetration, and you're using the scar tape to help soften and flatten and protect and keep the moisture in. So you simply alternate between the two. And there's different ways you can use them. You could wear the tape in the day And then at night, you could apply it back to the backing that you took it from and store it there and use the scar balm. And a handy tip is to have the scar balm by your bed, because you'll remember to put it on at night. And then you could reapply the tape in the morning. Mm-hmm. But of course, for the bigger incisions or the people that are really busy and running around in the week and they don't want to take the tape off at night, they could keep it on for a full 7 days, depending on skin tolerance, because everybody's different, but you can wear our tape up to 7 days. And then you would alternate with the scar balm the following week. So you could do a week on with the tape and a week on with the balm and alternate.
And like obviously people straight after surgery, they're incredibly keen to get going. What we do at Re is people are going home with a micropore tape, and then at 6 weeks they're getting the kit. Did you want to talk a bit more? Because just because they get the kit at 6 weeks doesn't necessarily mean that's when they should start using it. But just talking a little bit more about how early people can actually start.
This is really important because often patients get a little bit excited and premature and want to use their products too soon, and that can really affect the healing of the scar. So absolutely do not start your products too soon. Always wait for the instruction of your nurse or your surgeon to tell you that the scar is at a place where you can now introduce scar management products. And it really does vary, obviously, depending on the size of the incision. So that's why it's got to come from your surgeon or nurse. Mm-hmm. But as long as the incision is fully healed, you don't use any product on an open wound. And the micropore tape is such a good tape for that initial healing, wound healing period. It's porous, it's breathable, it's exactly what your scar needs at that point. And then once you're finished with the micropore tape, it's the perfect time to move on to that oil-based product and the silicone tape. So you're introducing it, you're seeing your patients at 6 weeks. Is that for your breast reductions and your abdominoplasties?
Yeah.
Yeah, so that's pretty much perfect timing. By then, the wounds are going to be in a really nice position to start introducing the products. Yeah. So 6 weeks is a great time to start introducing the Nokori range. Yeah.
And obviously we don't want people starting too soon, but is there like a benefit to starting earlier rather than later? Can people come in with decades-old scars and start to use the product?
Yeah, we also get asked that question a lot. Like, if I've got a 2 or 3-year-old scar, will it benefit? So we've designed the products to really be introduced as soon as you can. As soon as you get given the green light by your surgeon or nurse, you introduce the Nokori products. So they are designed to give you the best chance of reducing abnormal healing. Mm-hmm. So the sooner you introduce them, the better. Yes, you can still get benefits later down the track, but of course you're not going to probably see the benefits that you would have got if you had started them straight after your surgery at the time that you were allowed to go ahead and start using them.
Yeah, okay. You know, we've alluded to the fact that it can be 12 months, 24 months to get that full scar maturation. What kind of time frame are people looking at when they start using the products on their scars?
Yeah, absolutely. So yes, 12 to 24 months it takes a scar to mature. I think a lot of patients don't realise this. So it's really important for them to be patient because it does take time for scars to heal. What you're doing is if you introduce products at the early stage, you're going to help shorten that journey. And we say a minimum of 12 weeks to use the products, but most people end up using them right out until 12 months. Mm-hmm. So consistency, compliance and patience really do help when it comes to getting the best result.
Would you say the scar tape has like more of a subtle change, or is it something you can see quite an impact on from right out the set?
Oh, I'd say definitely it has a great impact without a shadow of a doubt. It's one of the most scientifically researched products for scar management. It started decades ago in burn surgery. And it's fantastic. It's creating such an amazing environment for the scar to heal. It's preventing an overproduction of collagen, so you don't get that hypertrophic or keloid scarring. So, of course, it's not going to help everyone, but it certainly does have a great impact with most patients. We actually had a patient recently that came to us. She had a scar, I think it was probably 18 months. And she did a before and after. She used the tape for 3 weeks. It was a scar on her inner thigh. And the difference was incredible.
That's amazing. I think 3 weeks is crazy. I'd never expected something to work like that quickly.
Yeah.
Are there areas of the body that the tape and balm work better on than others?
Yes, so the tape is often tricky to use in areas like joints, so on the knee or on the elbow, sometimes on the contours of the face like the nose. But it's pretty good all-rounder, really. The most popular place that we see it being used is breast reduction and abdominoplasty, which fits very nice with your patients.
Yeah.
But yeah, the scar balm is universal. It can be used absolutely anywhere on the body, but the tape, just because you are trying to keep it stuck down, it may start to peel off a little if it's on a contour or on a joint. Yeah. But overall, patients, absolutely love the tape.
Yeah, it's good. It's really sturdy. Like when we were putting it on the skin and taking off to put back on the backing, I was blown away at the fact that you could it kept that residual stickiness on there.
Without doubt, one of the advantages of the tape is how well it stays in place. Patients love it because there's nothing more annoying than putting something on and it peeling off. We've had great feedback on the adhesiveness of it. So
we have a lot of patients coming. You touched briefly on hypertrophic and keloid scars. We have a lot of patients coming in who think they have keloid, but it's hypertrophic. Could you speak to what the difference between those two are?
Absolutely. So it can be quite confusing. I guess the patient feels like it's similar because I think hypertrophic scars can often feel so bad, but actually hypertrophic scars stay within the incision line. They just rise up. They don't spread beyond. And you will find that they are red. So they're red and they're raised. Whereas a keloid scar really does go beyond the parameters of the incision line, and it really is quite thick. They're quite different when you look at a hypertrophic and a keloid scar. I would say most of the time, if hypertrophic scars can tend to improve and heal over time if you use silicone tapes, product scar massage. However, the ones that don't would need advanced treatment like steroid injections, laser, potentially scar revision. And then what you would do is if you had it revised, you would then go back to the basics and introduce your silicone and your scar balm from the outset. But yeah, unfortunately, a lot of the time genetics can be a big part of keloid and hypertrophic scarring. Ethnicity depends on where the scar is on the body, whether it was caused through surgical incision, a burn, an injury. So it really does depend, but there's definitely things you can do for hypertrophic and keloid scarring, and there's definitely treatments that can help.
Yeah, and it's good to, if you're introducing scar management, obviously you can't control your genetics, you can't control how you got hurt or how you scarred, but if you're taking away just one of the things that contributes to those hypertrophic scars later, then we'll take it.
Absolutely.
What do you think is the biggest mistake patients make when it comes to scar care?
I would probably say they try and use it too soon. They're so eager to use it and they just need to take a breath, have patience and just start it when their nurse or surgeon says to start it. I know that a lot of surgeons give out gift bags with products in there and it's sometimes there at home for them to use when they want, but they really should listen to their nurse and surgeon's instructions and really hold off using it until they're ready.
And what is one thing that you wish everybody knew about scarring?
I think that with compliance, time and being patient, you really can achieve good results, but you've got to comply and you've got to use the products.
No cheating.
No cheating.
Everybody thinks it's like going to the physio, right?
My physio exercises.
Yeah.
I think that doing just my 10 calf raises instead of once a day is fine. No, you've got to do them 3 times and 3 different exercises.
Yeah. Well, perfect. Thank you so much for coming in. Anything else you want to add?
No, I've really enjoyed it. Thank you so much for having me. Loved it.
Thank you so much for coming in. And yeah, for anybody that wants to try Nokori, get some more Nokori, we obviously have it here at RE if you're local, but otherwise where can people find you?
Yeah, so obviously if you are local, definitely come by here because you're going to save on shipping and everyone loves to save on shipping. But yeah, you can find us at nokori.co. That's our website. It will take you to our shop. I'd also just love to add we have got some really exciting products in the pipeline. So watch this space the next 18 months. So maybe we come back and do another session on the new products.
I'll be a professional podcaster then and remember to press record. Thank you so much. If you liked that episode, there's plenty more where that came from. Maybe start with some of these or head to our channel for your peek into the mysterious world of plastic surgery.